about hopefully making it easy for you to apply to become a registered health promotion practitioner if you're not already. Before we kick off though, I would like to acknowledge the continuing cultures and knowledges of the Aboriginal and Torres Strait Islander peoples, who are the original custodians of the land now known as Australia. We commit to working in collaboration with our Aboriginal and Torres Strait Islander members, their communities and workplaces in a culturally secure and respectful way. We honour the knowledges held by our Aboriginal and Torres Strait Islander colleagues and will be guided by their ongoing connections to country as we do our work. So, as you can see on this screen, I'm the chair of the National Accreditation Organisation Management Committee, and I work together with Tia, who's the chair of the NAO Assessment Committee, and Lucy Wickham, the deputy chair of that committee, and also Dimitri Batras, who chairs the CPD committee, and Margot Sendel, who works very closely with us on our IUHPE relationship and also on communications. The five of us are the management committee, and we report to the Australian Health Promotion Association Board of Directors for the implementation of this national accreditation organisation. So we've given this presentation, not this actual presentation, but we've given a similar presentation over previous years. So we didn't want to repeat too much about the history of the program, but we did want to just share very briefly some context for why this program exists in Australia and how it works. So I think that it's important to remember that this program is something that's it's an international program, and we, as the Australian Health Promotion Association, successfully applied to the International Union of Health Promotion and Education to run the program in Australia. So it's run in many other countries around the world by either a national accreditation organisation in that country, or if there isn't an NAO in that country, then it's run by the IUHPE. The program is a competency-based program, so it was established following a significant piece of work that came under the broad heading of CompHP, Competencies Health Promotion, and those competencies identify the requirements for practice that underpin health promotion, education and training, CPD and professional standards, and practice. So it's very much about what can we say that health promotion practitioners do using a competency lens. We felt that this was a very important strategic program to be implemented in Australia. And I must admit, even though I've mentioned that it's based on a CompHP program, the CompHP program itself was based on some work that AHPA and some leaders in health promotion in Australia, including Trevor Shilton and Ray James and others, that they developed core competencies for health promotion back in around the early 2000s. And those core competencies were the foundation of the CompHP work. So Australia's got a lot of skin in the game. We've been involved in this for many, many years. And then it was fantastic when it moved to the next level when IUHPE started to develop these competencies for health promotion internationally. We think that there's historically been a lot of misunderstanding about what are the competencies of health promotion when people have been employed as health promotion practitioners, and we hope this program of registration can contribute to improving a standardised knowledge of what is good health promotion practice. We also feel that as the program grows in the future, with greater understanding of the role of this program, greater acknowledgement by employers of the program, that it will become a reference point for employers in the recruitment and selection of health promotion practitioners. I'm not going to go through this slide in much detail other than to say that you can see with the circles that these are the competencies we're talking about, the competencies to advocate, to enable, to mediate, the leadership competencies, communication, planning, implementation, evaluation and research competencies, and competencies around needs assessment. These are the foundation competencies for good health promotion practice. Now, importantly, this program's voluntary. So it's a registration program, but it's not a program where, like, for example, as a registered nurse Division 1, you can't practice as a registered nurse if you haven't got that registration. We haven't set this program up like that. It's a voluntary program where people can choose to be a registered health promotion practitioner, but of course there are going to be people that continue to apply for health promotion positions and get those health promotion positions on the basis of their qualifications or their skills. It's not going to be compulsory for people to be registered, but as we mentioned, we think will distinguish people who can it'll be a great way for people to demonstrate how they can satisfy the competencies for good health promotion practice. As you can see, there's also a second part of this program, which is IUHPE Accredited Health Promotion courses. Now, Australia has got many courses already across now as a result of this program. Over the last 2 years, we have 8 accredited health promotion courses. This is a fantastic development. This is going to be really helpful for people to easily become a registered health promotion practitioner if they complete an accredited course. I'll talk a little bit about the various streams of becoming registered in a moment, but by participating in an accredited health promotion course, it means that people can easily demonstrate that they've studied and achieved the core competencies. I mentioned the IUHPE, and over the last 6 months, we've been working closely with IUHPE on the review of the program. The program's been going for about three or 4 years, and we in Australia have been running the program for just over 2 years. And so it's timely that the system, the handbook, the way it's being marketed, the way that the program, the relationship between national accreditation organisations and the global assessment organisation operates, and also the communication tools such as the website. It's important that these are reviewed, and as a very active NAO, we're delighted to be participating quite actively in all of those elements. Tia's working with the assessment committee. I'm working on the marketing group, and Margot Sendell is involved in reviewing handbooks and documentation. So we're quite active as an NAO in this program. It's in this review group, and so I just thought it was important to share with you that we don't see this as a static program. We see this as a dynamic program. I will say that we do get a lot of feedback from people about why is the program, why does this rule exist, or why do these competencies exist? Why aren't these processes or competencies included in the program? This has been developed by the IUHPE as an international program with a set of standards that we've signed up to. And so by signing up to that, we then are implementing a program that was developed by the IUHPE. This review committee is giving us an opportunity to put our hand up and say, hey, we've been doing this for a couple of years, we've got a fair bit of experience now, we think we could improve it in this way, we could modify it and accommodate some of that feedback that we've had from our members. We're also participating in conversations with other countries who are wanting to hear from us about the program, and they're interested in our experience. And we're sharing documents, sharing processes. We're very open book about how we run the program. And so just last week, Lucy and I met with Sione Tia, who's the Executive Director of the Health Promotion Forum of New Zealand, and they're looking at establishing a national accreditation organisation for New Zealand. We've also been invited to discuss the NAO with health promotion people in Indonesia. So there's an interesting opportunity for us to share and learn from others as we move forward. So getting down to the nuts and bolts of the program, we are talking about practitioner registration, and if anyone is interested in how universities become accredited, of course we'll put them in touch with the right people in IUHPE, but that's not a program that we administer. We're administering the registration of health promotion practitioners in Australia. I mentioned earlier that there are 8 accredited health promotion courses in Australia, and so graduates of those courses, only graduates of those courses after they've become accredited, they have a much simpler process to become a registered health promotion practitioner. A graduate of those courses just need to demonstrate that they just need to provide proof of graduation and apply to us as the NAO, and we can then approve their application and they can become a registered health promotion practitioner. If people are graduates of other courses that aren't currently accredited or weren't accredited when they studied, then in addition to that qualification and completing the self-assessment of their competence, they need evidence that they've been employed for 2 years within the last 5 years in the health promotion workforce. And then, as you can see, if people have got experience but they haven't got a health promotion course, they might have another tertiary qualification, then they need information re 3 years experience within the past 5 years. Once again, self-assessment of competence and some referees. So we just want to be clear about these guidelines come to us from IUHPE, and we are going to be administering your application in the context of these 3 pathways. I see that Courtney has raised the hand. We might take that question on notice and get back to it later on. So how are we going in Australia? Well, one of the reasons we like to show this logo is at the top that we see this very much as a partnership between Australian Health Promotion Association and IUHPE, and so we've got this joint logo, which we're very pleased that IUHPE was willing for us to market the program in Australia as a joint program. I've mentioned Tia and Lucy and Dimitri and Margot as people that are working with us on the National Management Committee, but in addition to that, we have about 25 other people who are either members of the Assessment Subcommittee, the CPD Subcommittee, the Marketing and Communications group that we had for the first year or so of the program, and also an Appeals and Complaints Committee. So we've got, and this group of course is comprised of people from all over Australia, and we do a heck of a lot of Skype, and it's a great Australia-wide volunteer-supported program of the Australian Health Promotion Association. We do have support from NFPAS, which is the secretariat of that supports AHPA's work, and they provide a small number of hours of support each month with administration, but 90+% of the work is by volunteers, and I think it's a great testament to the commitment of all of those people that we're able to do this program. We're very proud of the fact that we've got 65 registered health promotion practitioners in Australia now. This is way above the number of registered health promotion practitioners in any other country. So not that it's a competition, but we're still very proud that we're first. And so yes, we've got a huge pipeline of work ahead of us as well, with the people that have started their registration, because people can easily get into the system and commence their application. Then of course the challenge is doing the paperwork, because we're not stepping away from that. Demonstrating competencies is a bit onerous, and that's one of the reasons we want to talk to you today about what kind of information is required. So and you can see there, not necessarily that we always want to compete, but it would be great if we could just get a bit more numbers in other states and beat that Western Australian state, because they're just getting ahead of themselves, I think. There 28 in Western Australia, 12 in Victoria, 12 in Queensland, and 7 in New South Wales. Obviously there's so many people working as health promotion practitioners around Australia that we've got enormous potential for this program to grow. Now, I'm just going to skip over this quickly, but I've mentioned briefly about the pathways, but also, just to give a sense of, anyone can apply. I say health promotion practitioners, of course, it includes people working in government, in universities, in research. There's a couple of steps when people start their application. In order for that application to be submitted, they need to pay a $38.50 fee. And then once they're notified that their application's been successful, then if you're an AHPA member, your annual registration fee is $44. If you're a non-member, just because we felt that we needed to ensure that members were getting benefits for their AHPA membership, it's relatively expensive, shall we say, to be a non-member and to be a registered health promotion practitioner. I'd encourage everyone to just join AHPA. Then people are awarded the professional title of IUHPE Registered Health Promotion Practitioner. They're included on a national register and an international register as a registered health promotion practitioner. Their registration lasts for 3 years, and after 3 years, people need to submit a re-registration application where they can demonstrate that they've completed 75 hours of CPD over that 3-year period. And when people are registered, we send out some documentation, so it's very easy to keep a log of what they've done and then submit that. Okay, that's enough from me. So now I'd like to hand over to Tia, and Tia will talk to you a bit more about the practicalities of what it means to be submitting your application and having your application assessed. Tia.
Thank you, Andrew. I've just been looking at the chat, and maybe before I sort of go into the section I'm going to talk about, I might just answer a couple of questions related to the courses, or there was a few questions there that I can see about, would my course be covered, or is this course covered, and which ones fall into the 2-year experience or the second pathway. There is a very detailed handbook on the IUHPE website which you can go and access, which does give the whole system. But just in terms of the I'm going to bring it over. It's a hefty guide here. And I just wanted to list or to read out in terms of the courses, the types of courses that are listed within the system, the IUHPE system. It includes those with qualifications in public health, health education and social sciences, including psychology, epidemiology, sociology, sorry, I've lost my education, communication, environmental health, community, urban or rural development, and political science. So it is quite a wide range of courses that sort of meet that, and I guess it demonstrates the scope of work areas that health promotion practitioners do work in. It also does reflect a slightly European take on the range of disciplines that it includes there. And just for, I guess, some of the queries that we have had with different courses have been more along the health science, so allied health and health science qualifications. And usually it'll be maybe somebody who's from an allied health background, who is working, who may do some health education within their role, or it'll be somebody from health, an allied health background who has gone into a more health promotion, say, cardiovascular, if you're a physiotherapist who goes into cardiovascular work or falls prevention work, and then they do a postgraduate degree qualification in health promotion. They're quite different, and so I guess you do have to look at it from a case-by-case basis on what the qualification was and the focus, and then also what the role is, and then that gives us a bit of an overview or looking at what else they may have done to complement that. So it is a bit hard to sort of answer people's specific questions, but the handbook is quite detailed, and it is about recognising courses that actually develop competencies that meet the competency set for health promotion. So that's really when it drills down to it, because there's a lot of courses called similar things that are quite different in structure. So it really does come down to looking at what were the core units and competencies that come from those courses. So I hope that just answers people's questions there. It's a bit hard to answer everybody's question, and I did hear or see a few of my qualification was from New Zealand or another country. That's fine. It is about sort of submitting that information so that we can see what the course is and what the units were, and then we have a look at it from there. So hopefully it answers people's questions. Okay, so in terms of the registration, so within the Australian NAO, we do use an online registration system. So as Andrew's pointed out, there's a lot of people that have actually registered within this system. It is quite simple to get on and start an account and register and start working through the different registration systems. We have over 200, I think we actually have close to 300 people sort of registered in total within that system at the moment. And this is quite unique in terms of comparing with other countries. There's a few different systems that people are using in different countries, but AHPA has decided to go through this online website. The PowerPoint that you can see there just steps out the different sections, and you can see that the key information that's captured, so other than obviously the personal details and contacts, it is a key information that gives the summary and the evidence against the core competency, which is that health promotion competencies and the section 7 to 15 there, which are really important for people to think about what they're submitting in their application and how they submit that. And I'll go through a few sort of tips and practical application tips and some practical tips and some learnings that we've had along the way as we've been exploring this process, as you will. The qualifications are uploaded here, the employment details are uploaded here. It's really important that when you complete your application that you do provide as much information as has been asked for, and really think about putting the best evidence. It's not necessarily the most complex evidence. It doesn't need to be a complex project or the most high level if you're a senior practitioner. But it really needs to focus on the competencies, and that's what this whole system is built on, demonstrating competencies. So it's not about having the right degree. Yes, it helps if you're an IUP course graduate, but it's not about having the right degree. And then even for those course graduates, IUP course graduates down the track with the CPD area where you have to maintain some CPD, you then need to be able to demonstrate that you're against a range of competencies and different types of CPD. So it will come into play even for those who have got that streamlined system. Okay, sorry, Andrew, can you click for me? Thank you. All right, so in terms of application tips, and I'm just going to go through these, it's really important to have a look at the competencies as they are written in the IUP handbook and the competency outline. So there's a couple of different documents that you can look at that have those listed competencies. It's really helpful from an assessor point of view if you are using the same language as competency descriptions to describe your knowledge and experience. And what that means is, as an assessor, we can only look at what you've provided. So I'll talk about the assessment committee a little later, but it won't be somebody that knows you. So even if your manager is an assessor within this system, the manager, that's a conflict of interest. So if you've applied, you need to assume that we don't know you at all, because we don't know you at all. And that's the reality. So you really need to help us to understand that you know what those competencies mean, and that you can demonstrate that you've understood those competencies and you apply those competencies. So just keep that in mind. So using the same language that's in there is very helpful for us as well. As I've already said, I'll come back to the questions. They're popping up at the moment, but I'll back to the questions. The experience doesn't have to be the biggest, the most senior, the most complex. This system is built on a graduate level, so it is about early career graduate level competency. So even as a senior manager, if you've been working for a long time, it doesn't have to be the most senior work that you do. It is very much coming back to that competency and demonstrating your understanding of that competency. And if there are, I'm just looking, using more than one example, if there's gaps in your experience, because you may only have a couple of years of experience, or you may have only had one role and haven't had that opportunity to demonstrate your competency, you can use a combination of different examples, or you can at least acknowledge that you understand what it is, you do have a gap perhaps in that particular area. The competencies are quite expansive, but so it's that whole picture of understanding the competency and also being able to demonstrate it. And I think we've already covered that the new graduates from the non-accredited courses need to gain 2 years of experience to apply. And if it's when it's the distinction between the 2 and 3 years, it is about whether it's a relevant course as well. So it has to meet some of the, as I've said already, that range of courses that we talked about earlier. If it's a different sort of course, but then you can demonstrate you've actually applied, and worked in a health promotion setting and demonstrated those competencies, then we look at that, and that might be 3 years worth of experience to demonstrate the same. So it's the 2 or 3 years we need to go by the course. And just acknowledging that the assessment process may take some time, and again I'll come back to that in a moment. Okay, so I'll just get you to flick to the next. Yep, thank you. So in terms of the practical tips to applying, it's important to plan. So you can go into the system and have a look at the system, and you can see what's going to be required. But I would recommend that you prepare your responses to the competencies in a Word document separate to the online system. this will also provide a backup should the system not save your work, which we have had happen before. So it's really good to have your Word document and to take some time to put those statements against your competency set in Word before you come to upload them into the system. You think about it as if it's a job application. So you've got statements against the criteria. It may take a number of hours to put that together. And you need to think about the evidence that you're going to use, so how you're going to respond to that competency and what evidence best shows that. It's okay to use the same example throughout the application. We're not requiring you to use multiple examples, but you will find that you will probably need to use multiple examples just to demonstrate the range of things that are across that competency. I think it speaks to the drafting those brief response. There's only 200 word limits against the competency, so you have to pick and choose your words carefully. Please don't write, "I did this in my degree," or something to that effect, because we do have people that write that, and that makes it very difficult because we actually need you to show that understanding. So writing, as per my degree is not going to be helpful. You need to use those 200 words effectively. It's helpful to let your employer know that you're going to apply. This for a couple of reasons. Lucy's going to talk a little bit later about the employer's perspective, but it's good to let your employer know, or your manager know, or if you're going to use them as a referee. So the same as a job application, we don't always follow up with the referees, but they are there in case we want to verify something, and sometimes we do need to do that. It's really important in the application to use I statements. In health promotion, we tend to use the word we a lot. Because we work collaboratively, and so from an assessor point of view, if you are submitting something and you've said we've done this and we've done that, and we can't see what you have done, what your competency or what the evidence is that shows your competency, it makes it very difficult for us to determine, well, what was your role here, and examples also along those lines. People will often write about a project, not about their competency, and then they'll link a website about the project that we can't connect with that person individually. So it's really thinking, it all comes down to the competency. I know it sounds like I'm repeating myself, but it's really easy to fall into these sort of traps, I guess, of writing about the project and saying how the project is showing, it addresses these competencies, but you really need to think about, this is about you and demonstrating that you understand the competencies, that you have done something, and the evidence is yours. It can be tricky because often we work in organisations where the organisation gets the name on the report, or a senior manager, or somebody else might get the name on the report. So in your response, it's really important to identify your role in the evidence that you're putting up, if that makes sense. And really don't assume that we know your local context. So we might not know, we may know your project, but we probably won't, because we do try to make sure that we mix up the assessor group, and that we that if it's somebody from the same state, we'll try and look for someone who's in a different state to actually make that assessment, just to keep that sort of objectivity of the assessment as well. Okay, so I'm just going to talk a little bit about the committee, and before we go to Lucy's. So just so that you know, the assessment committee is actually 9 people, and in the very near future will be 8, as we have one of our assessors will be retiring from the group. It is a very small group, and we are across Australia. what that means is that if we get an influx, for example, from WA, let's say, we seem to have a lot of applicants, and there are a number of us who are in WA on the assessor group. So what that means is it can be quite difficult sometimes to allocate assessors when you've only got a small group. We will be hopefully expanding that group in the near future. We're talking about ways to do that, but it can be challenging, and obviously everyone's voluntary and at different time zones and all sorts of things like that. So that can be quite challenging to manage through the assessment committee, but most of us have been involved for quite a long time now, so probably going on 3 years, and some of us even longer than that. From the perspective of the assessor, there can be challenges in trying to unpack what people's applications are saying, but we've got I think we've got, Lucy, I think we've got fairly refined now that we're not reading between the lines, but we can fairly quickly pick some of the issues with certain applications, and we are getting better, and we're putting together more guidelines so that when we get new assessors into our group, we can share that learning, because coming into the NAO there wasn't really a lot of guidance about, you know, from the assessor's point of view, beyond what's in the handbook. So we've really had to grow that as we've gone through. Okay, but before I go to Lucy, the other thing I just wanted to say is just to highlight some reasons for delays with applications in the system, because it does happen. So for people that are applicants with the IUP courses, that's very simple. But there are some reasons that we do get delays within the system. Some of it is related to the assessor group. As I've said, we're volunteers, there's not many of us. Sometimes there's a conflict of interest. We get busy, we go on holidays, and we have viruses that hit the world, which take us offline for numbers of weeks. So there's things that come up that we just have to flow with, and sometimes that does result in delays in processing applications. We have some clunkiness within the website system. So there are sometimes people's applications that are getting caught in loops. So please alert us to, if you haven't heard within certain time. We certainly have some applications that have got caught in the system. We've had people that have got double accounts and then we can't marry up. They've said, I've completed my assessment, but actually they've got 2 accounts, so we're looking at an incomplete assessment. We're not sure what's happening. We've had people that have paid twice, and then because they've had 2 accounts, or we haven't been able to marry up the assessment, application. We've had old emails, we've had password fails. So there's lots of things that have happened through the system, and so that does sometimes cause a bit of a delay because it takes us a little while to unpack that. We are working with INEX to improve that system so that it'll be better. And then the applications themselves, if you're not clear around the time, your experience, is it paid experience, is it relevant experience, is it voluntary experience? If you're not clear on that, it makes it really hard, and we have to keep asking questions, going back to the applicants or to the referees. Again, with the statement of against the competencies or the evidence, if we're not sure, people are submitting things and saying this is my work, but it's actually got somebody else's name on it, we have to go back and check. If the CV doesn't add up, we have to go back and check. And when we're saying we go back and check, it comes through a system, it goes to 2 assessors, they look at it, they have to meet, they have to decide is there an issue, then it comes back, then we go to the applicant, then it comes back, and then it goes to the assessors. There's lots and lots of steps in the process. So the more straightforward that you can make it, the quicker the application will happen. But yeah, there are things that cause delays in the system, but it all comes back to getting that application as streamlined as possible at the beginning. So I don't know if there's any particular questions that are coming up on the chats that relate to that. Or if we'll move to Lucy.
Thanks, Tia. Will we keep going?
I think so, yep.
Okay, thanks. I'm going to talk a little bit about the employer perspective. In my day job, I'm the Health Promotion Manager at Peninsula Health. It's a large public health service in the southeast of Melbourne. We have 13 staff, and we receive integrated health promotion funding from the Victorian State Government. So I just want to talk about what I've done in relation to registration with my team. So we've encouraged the team to become registered, and that's as a starting point. We've also embedded the IUHPE core competencies into annual performance development reviews. This has involved a verbal assessment of their meeting of the core competencies. And I have to say my reflection on this, that it's increased my team's confidence around the realization that they are potentially eligible for registration. Like I don't have anybody in my team that has got any gaps in their competencies. They all meet the core competencies. We've included as a desirable criteria in the position description for the health promotion practitioner role, so everybody's on the same position description, a desirable criteria around being an IUHPE registered health promotion practitioner. In the longer term, we would be aiming to make that an essential criteria when we know that the bulk of the workforce is registered. And indeed, we've got a commitment from the organisation that in the long term, we will be moving towards mandatory registration for all health promotion practitioners employed at Peninsula Health. We have also offered a lot of support to staff around registration. So we've offered to review draft applications and offered to be referees. We've also indicated that if they didn't meet any of the competencies, that we would support them through the annual performance development review to fill that gap, whether that be through professional development or through on-the-job opportunities or in some other way. Once they become registered, we have also made a commitment to support ongoing CPD needs. And again, that's supported through the annual performance development review process, but also through our monthly and ongoing catch-ups with staff. Next slide, Andrew. So just talking about the benefits from an employer perspective. Let me just get this up here. I'm sorry, just going to my notes. So benefits, there's a number of those. In terms of individual staff, I have a couple of staff or a number of staff that don't actually have formal or even what I would define probably as relevant qualifications in health promotion. They have many, many years of experience as a health promotion practitioner, very capable and competent. So for those staff, it is a wonderful opportunity to have their experience and indeed their profession formally recognised. And for those staff, it would support employment transferability. And so for the organisation, so for Peninsula Health, registration facilitates the recognition of the quality of health promotion as a profession. So it acknowledges the high quality health promotion workforce that Peninsula Health has. It confirms our credibility as leaders in health promotion, or Peninsula Health's leadership in health promotion. And it also, the registration gives health promotion legitimacy as a recognised profession. It's bringing it on par with other internal roles, such as in our case, allied health or nursing roles, where, as many of you may know, accreditation or registration requirements, in fact mandatory ones, not just voluntary, but mandatory ones, have been in place for quite some years, and those are important for ensuring a quality workforce more broadly. Next slide, please. So in the longer term, Peninsula Health is committed to working, as I said, making registration mandatory for all health promotion practitioners. And as part of this, health promotion will be included in Peninsula Health's Allied Health Credentialing and Scope of Practice policy. At the moment, the team is currently employed as community development workers because indeed the EBAs that are available don't have any recognition of health promotion as a profession. So my personal view is that in the longer term, I'm hoping that registration will support advocacy to have health promotion recognised in the EBA, and that there would be a dedicated salary classification and grading system reflecting a level of qualifications and competencies to do the job. So what I would say to you is, if you're not sure about becoming registered, then I encourage you to consider becoming registered for the benefit of our profession, our health promotion profession, and for the health of our community. Thank you.
Thank you, Lucy. Fantastic. Now I'm not finding it easy to see the questions, so I can put them on my.
Give you a hand, Andrew, if you like.
Okay, great.
There were obviously a few specific questions to specific degrees and pathways, which I think Tia has covered quite well. If your question wasn't covered and you have a specific question to you, I would probably suggest emailing the NAO email address, which is on the screen at the moment. I'm just thinking more broadly. Now, this one, I'm pretty sure the answer is no, but someone asked about whether the membership of PHA gets a rate reduction. Yeah, so. No, that's PHA doesn't get a rate reduction, unfortunately, and the same applies with IUHPE membership. No, this is something that is conducted by the Australian Health Promotion Association on behalf of IUHPE, so no, people need to be an AHPA member to get a rate reduction. Thank you. Could you just repeat the cost of registration for AHPA members? It's $44?
$44 per year, that's correct.
Yeah. And is there options for people to pause their registration so they don't have to accrue CPD hours when they're not working, for example, during parental leave?
We have not thought that through, so we'll take that one on notice. That's an interesting question. Thank you.
Okay, I'm just skipping through. Tia, someone just asked whether, in regards of alerting, if they haven't heard anything about a system issue, how long should they wait to let you know?
The process can take a few months, so if it's more probably if you haven't heard for a few months to get in contact with us. You should be able to see if things are moving. It should send you a notice to say when it's been moved to being under review and as it's progressing through the system. So I can say if you've put one in recently, it wouldn't have moved too fast, yeah, we'll be getting back into that now that life is starting to return a bit to normal. The other question I did see Melinda was asking about volunteer experience. Depends. That's a hard question because it actually depends a little bit on what you mean by volunteer, what the role is. When you're talking about the experience, you're talking about relevant experience to the competencies. There's volunteering and there's volunteering. So it really depends on if you've got a voluntary role that's expansive enough that it has a position description type, often if it's quite an involved type voluntary role, it will have that type of associated sort of documentation with it. So we would probably look at that differently to somebody who might just do, not that there's anything, there's nothing just with voluntary. We obviously value voluntary work across, but you have to really think about, does it meet the competencies? And that's what we're looking at, not just sort of any voluntary work with, say, an agency, it has to be the type of role that you're doing in that volunteer work that relates to the competency.
Thank you. I was going to ask that question, so there you go. With referees, does it have to be someone with health promotion qualification, or can it just be someone they work with?
It helps if it's somebody who understands health promotion, because what we're asking usually it'll be verifying what somebody has said in their application. So it's good if it's somebody who understands or knows about the examples that you've put in, or the evidence that you've put in, that we might contact them to say, we're just confirming that this is correct. But it will help if it's somebody who understands health promotion and what those competencies are. That's why it is good to talk to the employers or your referees or your managers before you put the application in, so they understand what the system is about, because it is different to some of the other registration systems. So.
A quick follow-up question on the volunteering. Would a letter outlining the volunteer work from the organisation with the specifics be suitable?
It could be. Again, it depends on what it says. So we'd have to look at it on an individual basis, really. But again, it would be about really demonstrating those competencies.
Yep. Wonderful. And we had a question about how this accreditation system compares with other professional accreditation systems, e.g. the Dietitians Association Australia, other than it being a lot cheaper.
Yes, well, yes, the word comparison's interesting there. I guess the way it compares is there's a formal use of a term, of a title, and I think that becoming an accredited practicing dietitian is a formal term that's become embedded in the Australian health sector. And to become an accredited practicing dietitian, you need to do the accreditation program through the Dietitians Association of Australia, and that requires, my understanding, having worked with a few dietitians over the years, is that it requires people to have a master's in dietetics. Now, whereas this is not, obviously we've talked about the 3 pathways including for this initial period of the system, people without a health promotion qualification. So obviously people would never get an accreditation as a dietitian without a qualification as a dietitian, whereas this has quite a bit of flexibility around it at the moment in terms of the types of courses that Tia referred to, that are so it's quite open in regards to courses that might be appropriate as a foundation for the 2 years experience plus a course, and then there is this period, which I'm not sure how long it's going to go for, where other courses that that people without a health promotion or a health related course, but just with experience, can apply based on their competencies. Initially that was going to be for 2 years, but I know it's been extended, but I don't think they've made a decision for how long that 3rd stream is available. So that's a long-winded answer to a comparison question, but it's I hope that gives some context about those other more formal registration, sort of compulsory, non-voluntary registrations, whereas this is more of a voluntary system.
I think Lucy demonstrated really well how, although our system is voluntary, a workplace can start to put things in place to work towards it being mandatory, or at least an essential criteria in the workplace, which obviously is different than the other systems. We had, oh, sorry, go Andrew.
I can see a question around how broad is CPD. Very happy to talk to that one. The answer is very broad. So it's 75 hours over 3 years. There are about 6 or 7 different categories, and I won't be able to roll them off the top of my head, but the basic rule is that you're not allowed to have more than 33% of your CPD from any one of those categories. And they are as broad as participating in training programs, reviewing journal articles. You know, there is quite a bit of other activity that can be done that's classified as CPD. In fact, I even think reading journal articles might be included. So it's professional development in the context of self-development and participating in training. One of the things that came up when we were developing this program was equity. And equity is very interesting when you're talking about people in metropolitan sort of communities having access to so much, whereas people in regional and remote communities having very limited access to professional development and training. And that's why this program, that's one of the great things I think about this breadth of CPD that's available, that it means that once people can get through the quite challenging, we're all prepared to admit, quite challenging process of becoming registered, it won't be challenging to maintain their registration by keeping their CPD going.
Can I comment on my own experience of tracking my CPD? My experience has been the breadth and flexibility of the different categories of CPD makes it very achievable, I would say, for people. I've more than met, you know, I think more than met, probably way past 75 hours at this stage, because you know, there are so many things that you can log in there. And really, it really does reflect that equity. You don't have to spend lots of money. It isn't like allied health professions where you're spending, you know, hundreds or thousands of dollars on professional development each year. Nothing like that. It's a lot of what I do in my everyday work is relevant to log.
Great, thank you, Lucy. Now, I'm mindful of time. Is there any other question that jumped out, Mel? I was sort of scanning through as well.
I think that if anyone has any last questions, can you please pop them in now?
Yeah.
Oh, okay. Sorry, that was one that was missed, Elizabeth. Is a new graduate defined as someone who has finished their degree within the past 5 years?
Well, I'm not sure about a definition of new graduate, but we're not concerned about whether people are new graduates or not. I'm not sure of the context for that, but one of the issues around new graduates, I think, that is challenging for people is that they might have graduated from a non-accredited course, but they can complete the application, but they won't be eligible to be registered until they've got 2 years work experience. So
so the follow-up to that, Andrew, was it's about whether you apply under 2 or 3 years with that experience. So I think you've just, so it's around the experience, I think, that goes with the graduate component.
That's right. You need to have either that 2 years or 3 years experience, depending on the course, before your application will be approved.
And one last thing was, can your work experience count if it comes before you're graduated?
I'm going to leave that one to Tia, because Tia's probably had to grapple with this question many more times.
Well, it can, and you'll often have people that are working, have moved. Usually, that's usually how it's happened. They've moved from one sort of profession to and they're sort of moving into health promotion. So yes, it can do if it's a role that again is relevant and demonstrates those competencies, and then because then they may go and do a course to complement that, so that they're sort of moving in. So that's usually when you see that that situation. So they demonstrate it by the type of work that they're doing, but then they usually demonstrate it as well because they're doing they'll do a course or some training that also sort of shows that move. again, it's about what they're doing. So that example that I gave, I'm not picking out allied health in particular, but you do see that quite a bit where people might start within, you know, an allied health more clinical role, and then they move gradually. And so it's about putting together that time and that experience in when they've shifted role, rather than what they might do a little bit of in their role.
And there was a question about a postgraduate diploma, and I believe that those at a postgraduate diploma in health promotion would mean that you would fit in stream 2.
It depends on the course. There are a couple of postgrads in the that are IUHPE accredited. So if they are IUHPE accredited and they've graduated after the time of that being accredited, yes, they can be an IUHPE graduate. If they're, but otherwise it would probably be 2.
Stream 2. Yep, great. All right.
I just want to quickly say it is National Volunteer Week this week. And so knowing that this is run solely by volunteers, obviously we have a little bit of support through our admin organisation, but I would like to very much thank all the volunteers that are involved in this program, particularly as it is National Volunteer Week, but it's also thank you all year round, because it is a huge undertaking that everyone involved is doing, and it's seeing some very, very good results. As we said, we're #1 already, so yeah, but that's it from me. But Andrew, if you want to wrap anything up, please do.
Look, I just want to thank everyone for their interest. We're delighted that this is still gaining momentum, and we see this continuing to build in the years to come. And you know, we're early on our journey, but you know, it's got significant traction in Australia. You'll be seeing more promotion to employers in particular and key stakeholders this year. We've just had a conversation this week about a new marketing strategy, so that's gaining traction. So you know, what you've seen is the beginning of a program that's just going to go from strength to strength. The more we can embed this throughout the health promotion sector, and all of those people that are employing health promotion practitioners, I think that we're part of something that's going to make a difference for health promotion practice, for people that benefit from the work that we do, and for the careers of health promotion practitioners. So on that note, I'll say good evening and thank you very much for coming. Thank you also to Tia and to Lucy. Great.